Enalapril, sold under the brand name Vasotec among others, is an ACE inhibitor medication used to treat high blood pressure, diabetic kidney disease, and heart failure. It is recommended that it be used for as short a period as possible and at a low dose. In this video, let's find found. What is enalapril? What is enalapril used for? Contraindication. What are the side effects of taking enalapril? How does enalapril work? How to use enalapril? Enalapril, sold under the brand name Vasotec among others, is an ACE inhibitor medication used to treat high blood pressure, diabetic kidney disease, and heart failure. It is recommended that it be used for as short a period as possible and at a low dose. In this video, let's find found. What is enalapril? What is enalapril used for? Contraindication. What are the side effects of taking enalapril? How does enalapril work? How to use enalapril? What is enalapril used for? Indicated for the management of essential or renovascular hypertension as monotherapy or in combination with other antihypertensive agents, such as thiazide diuretics, for an additive effect. Indicated for the treatment of symptomatic congestive heart failure, usually in combination with diuretics and digitalis. Indicated for the management of asymptomatic left ventricular dysfunction in patients with an ejection fraction of less than or equal to 35% to decrease the rate of development of overt heart failure and the incidence of hospitalization for heart failure. Contraindication. Clinicians should avoid using enalapril or, if necessary, use it with caution in patients with aortic stenosis, myocardial infarction, stroke, hypertrophic cardiomyopathy, collagen vascular disease, example, SLE, renal artery stenosis, and renal impairment. Side effects. The most common side effects of enalapril include increased serum creatinine, 20%, dizziness, 2 to 8%, low blood pressure, 1 to 7%, syncope, 2%, dry cough, 1 to 2%. The most serious common adverse event is angioedema, swelling, 0.68%, which often affects the face and lips, endangering the patient's airway. Angioedema can occur at any point during treatment with enalapril, but is most common after the first few doses. Angioedema and fatality therefrom are reportedly higher among Black people. Agranulocytosis has been observed with enalapril. Pharmacodynamic. Enalapril is an antihypertensive agent that exhibits natriuretic and uricosuric properties. Enalapril lowers blood pressure in all grades of essential and renovascular hypertension and peripheral vascular resistance without causing an increase in heart rate. Individuals with low renin hypertensive population were still responsive to enalapril. Enalapril is not highly associated with the risk of bradycardia unlike most diuretics and beta blockers, and it does not produce rebound hypertension upon discontinuation of therapy. Enalapril is not reported to produce hypokalemia, hyperglycemia, hyperuricemia, or hypercholesterolemia. In the kidneys, enalapril was shown to increase renal blood flow and decrease renal vascular resistance. When used in combination, enalapril was shown to attenuate the extent of drug-induced hypokalemia caused by hydrochlorothiazide, and the antihypertensive effects of both drugs were potentiated. Mechanism of action. The renin-angiotensin-aldosterone system, RAAS, is a signaling pathway that works in synergism with the sympathetic system to regulate blood pressure and fluid and electrolyte homeostasis. Activation of this system upon stimulation by different factors, such as low blood pressure and nerve impulses, leads to increased release of norepinephrine, NE, from sympathetic nerve terminals and effects on the vascular growth, vasoconstriction, and salt retention in the kidneys. Enalapril is a pharmacologically inactive prodrug that requires hepatic biotransformation to form enalaprilat, its active metabolite that works on the RAAS to inhibit ACE. ACE inhibition results in reduced production and plasma levels of angiotensin II, increased plasma renin activity due to the loss of feedback inhibition by angiotensin II, and decreased aldosterone secretion. Decreased levels of angiotensin II subsequently leads to the dilation of peripheral vessels and reduced vascular resistance, which in turn lower blood pressure. Half-life. The average terminal half-life of enalapril is 35 to 38 hours. The effective half-life following multiple doses is 11 to 14 hours. The prolonged terminal half-life is due to the binding of enalapril to ACE. Dose. The dose of this medicine will be different for different patients. Hypertension. Oral. Initial, 2.5 to 5 mg POQ-day. Maintenance, 10 to 40 mg/day POQ-day or divided Q12HR. 4. 1.25 mg per dose 4 over 5 minutes Q6HR. Doses up to 5 mg per dose 4 Q6HR have been administered. Left ventricular dysfunction. Initial, 2.5 mg POQ12HR. May titrate up to 20 mg per day. Congestive heart failure. Initial, 2.5 mg POQ-day or Q12HR. Maintenance, 5 to 40 mg/day PO divided Q12HR. Titrate slowly Q2 weeks. 4. 1.25 to 5 mg Q6HR. Avoid administration in unstable heart failure or acute myocardial infarction. Conversion from 4 to oral dosage form. If not concurrently receiving diuretics, initiate enalapril 5 mg POQ-day. If concurrently receiving diuretics and responding to 0.625 mg 4 Q6HR, initiate at 2.5 mg POQ-day. Titrate upwards as necessary. Safety advice. AUTGA pregnancy category, D. Risk summary: use of drugs that act on the renin-angiotensin system, RAS, during the second and third trimesters of pregnancy increases fetal and neonatal morbidity and death. Adequate methods of contraception should be encouraged. Advise pregnant women and females of reproductive potential of the potential risk to a fetus. That's all the information about enalapril we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.